hierarchical structures and often prioritize Western organizational frameworks and values. That should be no surprise to us. Frequently, these can be seen as exclusionary and, depending on where you are in the world, neo-colonialist. Western approaches often overlook the social and cultural contexts of a community. In a high-level sense, Indigenous knowledge and ways of knowing focuses on holistic approaches where individuals, the community, and the environment are interconnected. And I think that's really important, a fundamental piece to understanding the diversity. We know that health outcomes for Indigenous peoples improve when First Nations, Inuit, and Métis control and administer health services in a manner that incorporates culturally safe spaces, elders, and traditional medicines. Indeed, the National Inquiry into Murdered and Missing Indigenous Women and Girls, Call to Justice 7.1, calls on governments to recognize that Indigenous peoples are the experts in caring for and healing themselves, and that health and wellness services are most effective when they are designed and delivered by the Indigenous peoples they are supposed to serve, in a manner that is consistent with and grounded in the practices, worldviews, cultures, languages, and values of those communities. Beyond improved health outcomes, by administering their own health services, Indigenous people are able to exercise their inherent right to self-determination and self-government, and I'm speaking particularly of Canada. Here's an international example. In New Zealand, they incorporated a new health approach inspired through Maori cultural values referred to as whānau ora. This new health initiative is an inclusive approach to providing services and opportunities to families across New Zealand. It empowers families as a whole rather than focusing separately on individual family members and their problems. So really looking at the context and where that individual sits. A knowledge keeper and an elder who is included in Canada's global health leadership may ask whether our efforts are culturally appropriate to the people we are trying to help. They might encourage us to seek out and include local knowledges and local elders to participate. The idea of the Government of Canada including Indigenous peoples into global leadership spaces and for the purposes of this conversation in health spaces is not totally new. Global Affairs Canada released in its Action Plan on Reconciliation in 2021 and claimed that one of its goals was to expand and deepen partnerships with Indigenous peoples in Canada and around the world to enhance their participation and respond to their identified priorities. Under this specific goal, Global Affairs Canada said that it would undertake meaningful engagement with Indigenous partners in Canada on their priorities regarding Canada's international advocacy and diplomacy, trade and investment, development, peace and security programming, and help for Canadians abroad. And finally, if we are to include Indigenous knowledge keepers or elders into Canada's global health leadership, who are able to incorporate Indigenous ways of knowing, we cannot look at their knowledge as an alternative perspective. Rather, it must be fully incorporated into our global efforts to be truly successful. Hi.
Thank you. Thank you for those inspiring remarks. And it seems so simple when you said it at the beginning. The best way to include Indigenous voices is to include them. But we know it hasn't been that simple, and really value the work that you've done to incorporate that into your work. I want to sort of move now, sort of taking what we heard from you, Senator Greenwood, sort of move to Canada's leadership on a more global stage. So for Joyce, thinking about Canada's commitment to equity, diplomacy, the threats to multilateralism, what have you observed about Canada's strength and leadership moving forward in global health?
Thank you very much, Nandita. And it's certainly an honor to be on this panel with so many distinguished guests and co-speakers, and to follow Senator Greenwood is certainly an honor. I think overall, and actually picking up on what the Senator had spoken about, Canada is in a unique position because we do live in a very diverse society, and it's important that we bring that to the fore in the work that we do. One of the biggest observations that we see here in Geneva when it comes to global health is what we call the North-South divide. So North being Canada and other what we call different constituencies that would often include Europe and North America, Japan and Australia is those that are, considered to be more industrialized, and then the South being those such as from Africa, some of the South American countries, but also parts of the Asia Pacific, considered to be those that maybe have not always had a seat at the table, or have had a seat at the table but a different relationship. And with COVID-19, that chasm actually got bigger, and recognizing that the world in terms of the way supply chains work and value chains work aren't always equitable. And I think Canada, unfortunately, was called, and really, these issues were raised, what is Canada's role in this, and how can we do better? I think that even though we have this division that is growing, I think there's opportunities of actually having more equitable engagement. And what we're seeing is that a lot of other member states from the Global South are taking up more space and really becoming more engaged, and redefining how we look at global health within the UN system, in particular at the World Health Organization. And I think for Canada, that means that we have to rethink about what we see as quote unquote international development, that it's not just about aid, but it's about capacity building, about sharing power, but also working together more closely. And this gives Canada an opportunity to actually forge those relationships even further to work cross-regionally as well. In terms of also Canada's opportunity to create that equitable space and to encourage multilateralism ongoing is good governance. Canada has always been a champion of good governance within the UN system, and by knowing what the rules are, it makes it easier for us to play, so to speak. And I think ensuring that everybody at the table has an opportunity to have their voice and to be a part of the decision making, that's a role that Canada can play. And it's also important for good governance because of accountability and transparency as well, so that we know and we're very clear about how decisions are made and the implications of them. I think the final shift I want to touch on is in terms of what we're seeing in multilateralism and in global health is sustainable financing. We've seen a lot of shifts in our global ecosystem, global health ecosystem in the last year in particular, but really it sort of just sped things up. A lot of countries like Canada unfortunately aren't in a position to provide as much overseas development assistance. And many countries have committed themselves to increase their own financial spend within their own health sectors. And I think finding that balance and working together of how that can happen is an opportunity for Canada. And then when we look at also where we are with what some of you might know as the UN 80 process, where the UN is really rethinking, reimagining how it needs to look, we can turn to our partners and colleagues that work in humanitarian issues. They're going through a humanitarian reset, and they're doing things and they're changing things before they're being told to. And I think this is the opportunity for global health, the global health community to be also doing the same as well. So I'll just leave it with that, and I look forward to discussion afterwards. Thank you.
Super. Thank you, Joyce, for your comments. And certainly it's an interesting time for multilateralism these days. And I apologize, Joyce, because I didn't introduce you properly. Joyce Seto is the Health and Development Counselor at the Canadian Permanent Mission to the UN in Geneva. Thank you again for being here. I'd now like to turn it over to our next speaker, Prativa Baral, Deputy Director, Pandemic and Emergency Readiness Lab at McGill University. She's an assistant professor. And Dr. Baral has been involved in the seminal report that came out earlier this year on Canada's leadership in global health. And I thought maybe, Prativa, if you would be able to share some of the highlights from the report with us. Those of you online may not be familiar with this report, but it really outlined some key strategies and ways for Canada to show its leadership in global health. So Prativa, I'm going to turn it over to you. I will pop the report into the chat. I think you should all have access now. Apologies for that. But Prativa, you have the floor. Welcome.
Thank you so much. Thanks, everybody. Hi, all. It's really lovely to see so many of you here today. I'm going to attempt to bring in almost 2 years of work in 5 minutes and try to do the report justice. As we all know, the global health terrain is shifting in quite profound ways, as been mentioned by some of my co-panelists today. And we're living through a poly crisis and accelerating climate change, geopolitical instability. I think we're all aware of the uncertain period, not only of the field, not only of the world, but also the field itself. There's a lot of questioning of what the role is of global health. How do we define it? How do we structure it? Where are the power dynamics involved, and how do we shift that given these changes? And so it's kind of in that context that this report was convened by the Royal Society of Canada and the Canadian Academy of Health Sciences to really try to determine what should Canada's role in global health look like in the future. And so our starting point was simple, but important given these shifts, that Canada is a vital part of this changing role, and that it cannot and should not stand apart. I know we're seeing a lot of isolationist policies that are popping up around the world, and we really wanted to highlight with our report that we cannot protect and promote health in Canada without active global cooperation, global engagement, without advancing health and well-being abroad and domestically. So this embeddedness of global and domestic health as being something that's deeply connected is what the starting point of our report. So the report lays out 7 key findings, and I'm just going to share a brief slide just so you can kind of see what we cover. So this is a very, very brief summary. I really encourage you to read the report for the specifics. But essentially, we highlighted or differentiated 7 major findings. On the left are the what. So these are key issue areas that we think require priority attention, and where Canada's leadership can make a substantial contribution. And if you can, as I go through them, you'll see that each issue area embodies that domestic global interconnectedness that I mentioned earlier. And then on the right side are the remaining 3 findings that really concern the how processes that Canada can take to push forward these priority issue areas. And then in the middle is almost like a cornerstone of our report, this focus on healthcare and the health workforce crisis and what Canada can do on that front, both domestically and globally. So I'll quickly go through the 7 findings. So on the left, we have equitable universal health systems centered on women and primary care. We all know that Canada has been a champion of universal health coverage. And so the report kind of pushes the idea of converging universal health coverage and primary care reform that offers an opportunity for Canada to lead. And so we recommended an accelerated strategy that prioritizes or continues to prioritize women's health, the health workforce, and innovative financing. And a specific example that we're recommending as part of the report is that perhaps Canada could lead ways in providing universal contraceptive coverage in order to meet the unmet need among women and adolescents by 2032. So we tried to put specific elements into every single one of our findings to make it a little bit more tangible. The second one at the bottom.
Sorry to interrupt. Is it possible to make your slides full screen? I think it's a little bit cut off.
Oh,
Yeah.
is it?
There we go.
Perfect.
Much better.
Is this better?
Thank you. Yes.
Okay,
Yeah.
apologies.
Thank you. Please go ahead.
Thank you. Yes. So the second piece is on One Health security. And I want to urge everybody to reflect a little bit on the fact that we specifically wrote One Health Security and not health security, because we wanted to move beyond the narrow definition of biosecurity. And a One Health Security would be to really think through prevention of upstream risks like pathogen spillover, and also downstream preparedness. So looking at it from a very planetary perspective, and investing in core capacities in order to do that, that really focus on sustainability and equity. The third what is on renewing health promotion and protection through a focus on well-being. A lot of the discussions that we had at the panel was really about the commercial determinants of health, right? So the ways and systems in which industries shape our health and our health systems, and how commercial actors drive health and equity. So really focusing on how can Canada lead to govern some of these industries, but also think through how that impacts us domestically and globally. So I'll ask you to look on the right side now, where we talk about the how. And actually before that, maybe I'll just focus on the health workforce crisis, because this was a little bit like our central focus for all of our recommendations. So health workers, as we know, are very much the backbone of any system, and yet we haven't really spent as much of a primary focus on investing in the policy and research around that. And so in Canada specifically, we know that we are increasingly relying on internationally educated health workers. They make up nearly 15% of our workforce. And so what we're proposing with this report is a flagship initiative that we call the Canadian Emergency Workforce for Health Innovation Program. That's what you see on this slide, with the goal of reaching net zero poaching by 2035. So what that means is that instead of drawing talent from low and middle income countries, Canada should co-invest with them to train, retain, and support the global health workforce. And we hope that will really generate lots of health workforce solutions that reconcile this domestic and international labor market realities and tension. And then on the right side, very, very quickly, the hows. We talk a lot about how global health still is quite fragmented. And so we proposed a clear Canadian global health strategy. We still don't have that as a country, at least not explicitly. And so we would want to see a strategy with vision, priorities, governance, resources, and monitoring that kind of advance this global and domestic health together, not as trade-offs, but as interconnected policy goals. The second one is strengthening research and innovation systems. So a little self-explanatory here, but really thinking through having a complementary strategy to a global health strategy that focuses on research and innovation, including in emergencies, looking at some of the examples that we see in other countries. And then the last finding is fortifying leadership capacity. A big focus of the report was really thinking through how do we train leaders to combine not just technical expertise, but also a lot of the skill sets that are required to work in global health. So negotiation, diplomacy skills, equity focused research and practice. And so we recommended creating a global health ambassador to kind of help consolidate a strategy that cross-ministerially and cross-jurisdictionally as well. Canadian Global Health Hub to mobilize or increase the research to policy pipeline, and then a global health diplomacy and innovation program to help train the next generation. So this was a lot, I threw a lot at you, but essentially the report's message is that Canada's leadership has to link the global and the domestic, and we obviously need to prioritize equity and sustainability. And we need to be a little bit more explicit and coordinated in the ways that we do that. Otherwise, we risk being reactive. So I'll pause here now, but I really encourage you to read the report and provide feedback. We know that the world is shifting and has shifted substantially since this report has been released. So please take that with a grain of salt as well while you're reading this report.
Super. Thank you so much, Prativa. That was excellent. And thank you for keeping it short. I know there's a lot in that report. Please do check it out. I've put the link in the chat. And there are a number of articles as well that you can find online. Certainly local is global and global is local. It was my take-home message. And I think a lot of us, I think that's sort of a through line that we heard from Senator Greenwood and others, and kind of feeds nicely to our next speaker, who is Megan Aikens. She's the Director of Strategic Partnership and Gender Equality at CanWatch, the Canadian Partnership for Women and Children's Health, where she provides strategic direction, issues management, stakeholder engagement expertise to advance priorities across its large membership. And so, Megan, for you, as we think about this theme that we really need to think local when we're thinking global, I want to sort of have you reflect a little bit on what this means for local civil society, local networks, and the role that they can play in advancing some of these larger global health and domestic health goals. So Megan, I will turn it over to you.
Thank you so much, Nandita, and good morning, good afternoon, good evening to everyone here. It's such a pleasure and an honor to be with all of you today. And I think what's really important for us to reflect on is that just like how significant of an inflection point for gender equality and, of course, sexual and reproductive health and rights we are at globally. And the data really tells a sobering story. At this very present moment in October in 2025, we have over 250 million women who still lack access to modern contraception. We know for the first time in decades, in 2 decades, that maternal deaths are on the rise. They're trending in the wrong direction. And also, maybe most sobering, is that we have 4.5 billion people who are living in countries where access to safe and legal abortion is restricted in some way. And so across the world, across regions, from Afghanistan to the US to Sudan, we're seeing women, girls, and gender diverse people face renewed attacks on their autonomy, their shrinking civic space, and increasing violence. And as Prativa spoke to, all of this is compounded by the polycrisis in which we're living through, shaped by conflict, climate shock, and really an overall erosion of trust in public institutions. And so how can civil society step up and respond to the moment in which we're living through? And I think I'd like to speak to 3 imperatives this morning. And at the heart of each of those imperatives is local leadership. And the first is that we need to recognize that the defense of rights is already happening everywhere. Around the world, women's rights organizations, youth advocates, and health networks are leading this fight every day, often at enormous personal risk. The question is not whether civil society is responding, but whether we are resourcing those who already are. And that means shifting funding, visibility, and decision-making power closer to the ground. Localization isn't and shouldn't be just a buzzword. It's the difference between fragile progress and lasting change. When we put local partners at the heart to lead, solutions are culturally grounded, politically relevant, and much more sustainable. And the second imperative is that we need to stand in solidarity, but not superiority. Global networks like ours, like CanWatch, like CAGH, must use our platforms to amplify and not overshadow. Solidarity really means sharing space with Indigenous leaders, with women's rights leaders, with gender diverse advocates, and with those whose voices are often let out of policy conversations. It also means standing beside our partners, not just when things are going well, but when it feels uncomfortable, when rights are being rolled back, and when we see civic space closing, when funding becomes uncertain. That's when our local partners need us the most. Our role in this global network is to hold the line and to remind our governments that these rights are universal, indivisible, and non-negotiable. And then the third imperative is really about building partnerships that are rooted in both trust and accountability. Organizations like CanWatch and CAGH can bridge research, policy, and implementation, but we have to do it through authentic, real partnerships. That includes investing in community-generated data, co-designing programs, and creating accountability mechanisms that flow in both directions. Ultimately, I think what we're talking about today is that defending rights requires redistributing power, ensuring that those most affected by inequality have not just a voice in the conversation or a seat at the table, but have real agency over the decisions that shape their lives. progress on gender equality has never been linear, but it has always been collective. And civil society's greatest strength is in our ability to stand together across borders, across identities, grounded in humility and courage and solidarity. So I think if there's one sort of key message from my reflections this morning, is that the defense of rights really does begin at the most local level, but it succeeds when the global community chooses to listen and most importantly, to resource and stand beside those who are already leading the way. Thanks,
Thank you.
Nandita. Back over to
Thank you, Megan. That was really powerful, and lots of responses from our participants. And actually, it feeds really nicely into, you know, the points that Senator Greenwood made about really centering Indigenous voices in some of this work. So I'm going to go back to Senator Greenwood, because we heard from Megan sort of the need for authentic, real partnerships, really shifting that power. But what does that look like in your expertise? What do you, and how do you balance that shifting power, balancing domestic priorities with global health and equity? So if you could just reflect a little bit on, we know what to do. The question is, how do we do it in a meaningful and sustainable way?
Thank you again for your question. And I was remiss in when I first spoke. I need to acknowledge that I am seated on the unceded territories of the Silks people, and I'm grateful every day that they allow me to work, live, and play on their lands. So hi to them. A really interesting question, and thank you to the speakers that spoke after me on this panel. Just such powerful statements. It's just amazing in addressing the complexity of the world that we're living in. So when I think about this question, and sort of from the place that I'm sitting at right now, I think about that, you know, we're in a totally different world today than we were even a year ago. And a lot of the realities have changed in our roles. Countries that once could be relied upon have stepped back from the world stage, leaving a great vacuum. And I think about that, and the question becomes, how do we collectively fill that vacuum and continue to do that sort of collective work? And I'm going to talk about Canada specifically. It is really facing an existential crisis where our sovereignty and our economy are being challenged by our closest neighbor and ally. And as a result, our attention has been focused in many multiple places. But, you know, I remember the Prime Minister's words, and he says, if the United States no longer wants to lead, Canada will. And I think I heard that from all of the speakers this morning, the power of women, power of us leading. If Canada wants to expand its relationships and makes its presence felt and expand its reach as a global leader, especially in the face of waning American commitment, stepping forward and filling that vacuum, not as just a leader, but the leader in global health, is how we can do that. And I see our country being able to take that. And I don't mean that in a way that is power over, and I think we heard that message from the speakers this morning. But what kind of leadership is it that we need? And from when I think about this, and I think we heard a lot of those attributes of the kinds of leaders that we want to be as a country, I think about leadership's more than providing funding. Leadership is about integrity. It's about holding up principles, values, and ethics. Leadership is shared and it's reciprocal. From this place, I think Canada can lead. And I think we've heard that this morning. Domestically, it may be hard to sell foreign aid as something imperative in the face of Canada's new challenges. We need to position these initiatives to the Canadian public and parliamentarians. It's more than just a moral and strategic imperative, but as an investment in reinforcing Canada's position in the world. And as an investment, when I think about this, I think about it as an investment in those coming behind us. We are doing right now, in this time, in this place, we are doing our work. We are doing our work to bring justice and equity to the world. And we have to think about those coming behind us. What is it that we're going to leave for them? So to me, it's more than just a monetary investment, a moral imperative. I'm thinking about our children and the world that we're going to leave them. And how do we help those women that are standing beside us today in all those different places that you all spoke of this morning? How do we support them? That's always been my question. So thank you for listening to me. Hi.
Thank you. So it's so moving to hear you speak, and your passion, and thank you again, Senator, for your moving remarks. And I think one of the things you touched on was sort of, what does leadership look like? Its integrity, it's shared. And I want to come back to Joyce, because Joyce, you're sitting in the multilateral world, which is all, which is different member states. It's working with countries that we may not always align with. But I wanted to get from your take, what have you observed, and what do you think about Canada in terms of leveraging its role in this UN system to advocate for more strategic partnerships to advance global priorities? It's the choice. I'll turn it over to you. Not an easy question, but
no, it isn't. And it's hard. I think that it is a hard question, and I think that the senator raised a lot of big questions for us that, as the public service, we're thinking through and waiting for leadership to give us the right direction. And I think it's really important that I know that also Senator Beam also has a lot of these issues at his heart as well. So I think hopefully there'll be some engagement on that as well. But all that to say is that one of the things that we're seeing within WHO, and I'll speak to that specifically, is that we recognize that Canada doesn't have, we're a middle power, and that we do not have the the Treasury, the amount of funds that we could actually increase our voluntary contributions to a lot of these organizations, and to also a lot of international civil society organizations. And so we can sort of provide that type of support or fill in those gaps. But what we are able to do is provide that gap in policy leadership. And we very much recognize that Canada is the sum of all its parts. So it's everybody actually on this call right now, where the WHO has turned to us as from a diplomatic point of view, saying, we know that Canada has an extremely strong academic community. We know that you have an extremely strong healthcare system. Other countries want to learn from your system, want to be engaged with your intellectual leadership. How can we help facilitate that? And so those are really big questions that where there are opportunities for those of you on the call to really step up, and there should be opportunities for us to discuss further. And when I say we, I think my colleagues who are based in Ottawa, I think it's important for you to have these conversations with them and to see where we can play a role. And I think for us here in Geneva is for us to advocate the talents that do exist within Canada. The other element too is WHO recognizes, and the number just evaporated out of my head, but we have several WHO collaborating centers that are actually based in Canada. And how do we activate those to actually support the WHO in their work. And so those are things where I think we can play a bigger role and influence. And I think looking at Megan and, the role of civil society, I think Canada is known for its very strong civil society and outspoken civil society. And I think this is definitely the time to continue with that and to engage with your international partners to see how you can support and work with them as well. I think those are really the key things that I just wanted to highlight, is that our resources are actually within us, and we just need to rethink how that is nowadays, because we're so used to being the donor country, but we're not the donor country anymore. And really what we're bringing to the table is actually our thought leadership, and working together to do that, I think, will be essential for us to really challenge the really nebulous forces that are upon us right now in the multilateral community.
Super. Thank you so much, Joyce. Really important point that you made about, partnership is more than just funding. It's sort of, paving the moral way, policy, sort of being active in a way that goes beyond just the funding. And I think that's an important point that you made. So thank you for that. We have a little bit of time, so I want to encourage folks on the chat to pose your questions in the Q&A box or the chat, and I think we'll have some time at the end. But I do want to give some time to Prativa and Megan. Prativa, one of the points that Senator Greenwood mentioned was it was very moving, thinking about the future generations, our kids, future of humanity. And that includes the future global health researchers. And I was wondering if you could speak a little bit about your work investing in the next generation. How can universities, institutions really actively engage and pave the way for the next generation of public health researchers and practitioners?
Thanks, Nandita.
Go ahead.
Yeah, I just wanted to further highlight Senator Greenwood's moving words, and just thinking about leadership as a principled thing, as opposed to not just a moral and strategic thing, but really investment in Canada's future. And one of the biggest investment in Canada's future is the pipeline, the next generation of leaders in this space. I feel like I could talk about this for a full hour, but there's a lot that Canada can do in this space. One of the things that I'm thinking a lot about, as part of our report, we actually did focus groups with students across the country who are invested or interested in global health. And there's so much passion and interest and a desire to do work in this space, and not necessarily knowing how to do work and how to do it well. So one of the things that I would recommend is to integrate global health, equity, crisis leadership into core training. This is not just an elective anymore. We are seeing what's happening around us live. And so medical schools of public health, policy programs, we really need to teach not just global health, but all of the elements that make global health what it can be and what it should be, whether it's climate health, equity, crisis leadership as foundational skills to really understand that interconnectedness approach to understanding health. Part of this training, I think, should also be to train them to question why certain structures exist, right? There's a lot of conversation happening right now about the global health architecture as a field. And so really supporting that type of thinking, supporting innovation, how can we do things differently so that it's more equitable and so that it makes sense, rather than doing them because that's how we've always done it. The second thing that I'm thinking about as well is to create real opportunities for learning by doing. A lot of the things that we heard from students when we were doing our focus groups was, are there fellowships, or there exchanges, or there practical placements that we can participate in that would really allow young professionals to learn, not just in the classroom, but doing alongside policymakers, for example, and communities, and allow them to build not just technical skills, but as I mentioned previously, some of the other elements that are required in a global health career, so diplomacy, leadership, and whatnot. And I'm also thinking of Canada playing a convener role more effectively. How can we connect a lot of the amazing initiatives that are happening right here in Canada that are often led by young professionals to some of the stuff that's happening in the larger ecosystem? So there's a lot of ideas and entrepreneurial spirit here in Canada and globally. And so how do we foster these and provide people with great ideas with the right connections and spaces so that these ideas can really take shape and be implemented? And then the last thing I'll say is really bridging, again, providing more opportunities to bridge the domestic and global. So, as we talked about, Canada is uniquely positioned and they can connect the training across both of these contexts. We mentioned Indigenous health a number of times, equity a number of times, or even global health diplomacy of Baral. So I'm looking at Joyce when I'm saying this. So the silos really need to find a way to stop being so siloed and to really find those ways to really connect the amazing amount of passion and talent and interest in this space, and give students and early career professionals the chance to work across both these domestic and international settings and seeing these parallels, not as two separate things, but as an interconnected thing. And I'm just going to put a small plug here. So I'm based at McGill University, and we just launched a new BA program in global health that is accepting applications now, and we're starting. The program will start next year, and so it's really invigorating, I think, to start to see some of these efforts across the country, particularly at a time when globally the interest, or at least investments in global health, is kind of slowing down or being stopped. But I'll stop here.
Okay, thank you, Prativa, and congratulations on starting the new BA in Global Health. Certainly very exciting. I think one of the things you mentioned was sort of this idea of training, how to incorporate equity, into the curriculum for the next generation of public health researchers and program implementers. And I want to come to Megan, because one of the issues that we're seeing more and more is the rise of misinformation and disinformation. And these are huge challenges for global health. We're seeing it in the vaccine world. We're seeing it in SRHR, sexual and reproductive health and rights. And it sort of speaks to this idea of, well, how do we engage civil society? How do we engage communities? And also, researchers and the next generation of public health practitioners to address some of these challenges that I think we're going to see more and more of. So Megan, again, not an easy question. I think we could have a whole session on this, but would love your reflections and some of the work that you do. Thanks.
Sure. Thanks so much. And I think just before we dive in, and talk about solutions, I thought it's just helpful for us to make sure that we've got a common understanding about the terms that we're using, especially because we hear the terms mis and disinformation so often, especially in public health rhetoric. So of course, misinformation refers to the false or inaccurate information that's shared without intent to harm, whereas disinformation is false information that's shared deliberately to mislead or manipulate populations. And I think it's also important to acknowledge at the outset that things like cultural norms and traditional values are not homogenous, right? Even within a single country, community, or faith group. And what resonates in one context may fall flat or in fact even offend in another. And so understanding these differences is really essential if we want our communication to be both accurate but also respectful. And so it's in this context that, of course, both mis and disinformation can be deeply damaging, particularly as Nandita talked about, when they target vaccines, reproductive health, or gender equality. And both thrive when trust in institutions or what's seen as outside expertise is weak. And so again, I think this question really comes down to one of trust. And here too, local leadership is so central to our solutions moving forward. I think as a global community, as practitioners, as researchers, as policymakers, there's sort of 4 key actions that I would encourage us to reflect on. And one is really, and this sounds so simplistic, but we need to start with listening rather than just messaging, right? It's like too often responses to mis and disinformation focus on trying to correct the facts in real and quick time, rather than really understanding why certain narratives are resonating in a certain community. And local partners, whether these be faith leaders to midwives to community organizers, already understand far better than any of us the cultural, religious, and historical contexts that are shaping a community's belief systems. And so when we integrate their insight at the very earliest stages of co-design, our communication becomes not only more respectful, but actually far more effective. And it's the difference between translation, as the very sort of instrumental action, to true localization. And so the next thing, and I think perhaps most important and most profound, is that we need to invest in community-driven communication ecosystems. So civil society networks can help resource the people and the platforms the communities already trust. Local journalists, local health workers, youth collectives, women's groups, traditional faith leaders. And so what does this mean concretely? It means that we need to train, and building on what Prativa spoke about, is we need to train and support community health communicators to counter mis and disinformation at the source, whether that's through radio, whether that's through WhatsApp, whether it's through community meetings, to meet communities where they're already gathered, where they're already speaking to one another. We also need to partner with local media to ensure that fact-based reporting from the very outset is being undertaken on both health and gender. And then also we need to find new and innovative mechanisms in this very fast-paced world of communication to make sure that there is rapid information sharing, accurate rapid information sharing across civil society networks that can counter false narratives at the outset as they begin to circulate, so that responses are much more coordinated rather than fragmented. We know that some of these harmful messages are so deeply organized and so well resourced. And so as the counter to that, we need to be as equally as organized and as equally well resourced. I think one example really is during the COVID-19 pandemic. We know that in places like Kenya and Nigeria, civil society networks mobilized both midwives and community health workers to share accurate information about the COVID-19 vaccine through both door-to-door as well as digital campaigns. And these models now have been taken up to inform sexual and reproductive health and right access. So they use what was built during the pandemic to carry forward in work that's still going on today. The third thing we need to think about is to strengthen digital literacy and data transparency. As networks, we need, it's not even, and it's often considered a nice to have, but in this day, we need to invest in community-led research and data collection. And as we've seen in the last 6 months with DHS data disappearing, we need there to be community ownership of that data as well, so that misinformation and disinformation can be tracked early and addressed with evidence by local actors themselves. So we need to build into our programs that we're delivering digital literacy training, which is not, it's a bit sporadic at this moment. And then finally, I would encourage us or challenge us is that we need to pair evidence with empathy. We know that facts and evidence alone don't change hearts and minds. It's relationships and trust that do. And civil society really occupies that critical space between science and society. And so we need to bridge rigorous data with lived experience, ensuring that our messages are co-created, credible, and emotionally resonant. Integrating local culture isn't just a matter of courtesy anymore in 2025. It's an act of both respect and recognition that different ways of knowing are equally valid paths to truth. So ultimately, I think wrapping up, it's that misinformation and disinformation reflect a much deeper breakdown and connection between people, between institutions, and the systems that are meant to serve them. And our response then has to go beyond just communication tactics. It's about rebuilding credibility over time through openness, humility, and respect. And if we can create the conditions for honest dialogue, where evidence is shared in ways that make sense to people's lives and their experiences, that is how we're going to regain that trust. And I think that's exactly where civil society is uniquely positioned to lead. Thanks, Nandita. Back over.
Super. Thank you so much, Megan. And thank you all for your moving comments. I miscalculated. I thought we would have a few minutes, but I think I'm going to move straight to Colleen Davison to sort of give us a little update on CAGH. She's the Associate Professor in Public Health and Global Development Studies at Queen's University and is a CAGH Board Chair. So Colleen, over to you.
Thanks, Nandita. I really appreciate just a few moments at the end of today's panel. I'm joining from the traditional territory of the Anishinaabe and Haudenosaunee peoples in the Cataraqui region along the shore of Lake Ontario, beautiful central Canada. I want to thank everyone on the panel and to you, Nandita, for facilitating and organizing and taking on the stress of managing the chat, etc. today. It's a really rich and inspiring conversation, and it's a place where CAGH, I think, shows its strengths. CAGH is a convener, it's a partner, and it's a champion for global health equity, and we're a membership-based organization. Approximately 75% of our members, nearly 500 members, are based in Canada, and 25% are based currently in other parts of the world. Approximately 45% of our members define themselves as students and emerging professionals, so 55% are seasoned professionals. And as the chair over the last 2 years, I've really been reflecting on the strength of CAGH, its members, its network, its positionality. And I think by this, I mean that CAGH is really sitting in these in-between places. It sits between global health research and practice. It sits between early career and later career people. It sits between Canadians and non-Canadians. It sits between government, non-government, and many other things. And I believe these in-between spaces are really important and they're valuable with respect to global health progress. There's really opportunities that they facilitate and help us facilitate, because in these spaces, we get to share global health culture building and values. We can debate, create, and strengthen these ideas of culture and values. And in these spaces, they're not really owned by anyone specifically. So instead of the places being competitive or owned or overly structured or overly organized, I guess, from the top down, they can be places of meeting, discovery, relationship, and that's what I feel we were able to do today. Achieving global health equity requires, evidence-based solutions. It requires all the things that our speakers have been talking about today: collaboration, innovation, equitable distribution of resources, etc. And we need these cultures of knowledge translation, collaboration, culture of care, a value for diversity, equal rights, and being able to bring in and engage civil society, etc. So in our work, we are trying to do that and building solidarity with our members in their own places of work and living. So we are living out this culture as we are today, and we're really happy to be able to continue to do that with your support, with your engagement. As people were registering today, they were asked a question about whether they were interested or not in learning more about CAGH, and more than 300 people said they were. So thank you for that. And I put links to the website, to the member portal, our conference, etc. in the chat, and just really want to welcome people. You can become a member of our Global Health Directory without paying any fees. There's also a small membership fee that gives you added benefits. So please just take a look at those things and consider either remaining a member of our network or continuing. And thank you again to all the panelists and the organizations that are connected to today's webinar.
Thank you so much, Colleen, and for your leadership over the past 2 years leading CAGH. So I'm going to turn it over to Michelle. Welcome, Michelle. Michelle is an assistant professor of global health ethics at the University of British Columbia and has been instrumental in some of the conference, but also in co-authoring a piece that I thought it would be great for you to share a little bit about, Michelle. So over to you for a few minutes.
Absolutely. Thank you so much to all the panelists and as well participants for coming today to the webinar. I'm calling from the ancestral and unceded territory of the Musqueam people, for which I'm tremendously grateful. We've heard a lot about inflection points today, amplifying existing strengths and where opportunities may lie. I did want to just touch on some of the key takeaways for me personally, which really really resonated with me, which were about ceding power, strengthening relationships, focusing on good governance and integrity, and really about Canadians bringing thought leadership to global health, which I think this webinar is a great testament of. This webinar was inspired by board members of the Canadian Association for Global Health, observing drastic changes in the global health landscape, which I'm sure many of you are very familiar with. We've seen rising threats against public and global health, anti-science rhetoric, attacks on EDI or equity, diversity, and inclusion, dismantling of foreign assistance, and we really worried about the repercussions of these, not just for the current moment, but longstanding ripple effects of this. So as an association, this really was central to us, given our focus on health equity. We not only contemplated these implications, but also the opportunities, given what we've discussed today, that Canada is very much well positioned to lead in the global health space. So as board members, we recently penned a correspondence piece in the Lancet to share our views that global solidarity is needed now more than ever, which is the title of this piece. And in this piece, we call upon our colleagues to really raise concerns and urge governments to invest in global health and contribute to just a more prosperous world for all. And we're really of this mindset that global solidarity can be our pathfinder for these uncertain times. And one step that we can really take towards solidarity is to have frank conversations about the future of global health. What is needed now? What does the future of global health hold? How can we reinvent a reimagined global health? And really, as a convener, the Canadian Association for Global Health hosts the Canadian Conference on Global Health, which carves out a space to have these types of conversations. And this year, we're delighted to be hosting the conference in Halifax, which is on the ancestral and unceded territory of the Mi'kmaq people. And this year's theme is aptly titled, Navigating the Path Forward, Advancing Global Health in a Changing World. And it's to take place from October 24th to 28th. I know that it's a bit tight as it's in a few weeks, but I would encourage you to look into the hybrid option, because there's been a lot of attention paid to this to really ensure that colleagues who are unable to secure visa or travel are able to attend. So I would just encourage you to take a look on our website for all of that information. So thank you again for taking the time from your busy schedules and really taking this step towards solidarity. Thank you.
Thank you, Michelle. And thank you again to all of our panelists. Senator Greenwood had to jump off for another meeting, but I really appreciate all of your time. And to our participants online, thank you again for your dynamic discussions in the chat. If this was interesting for you, please let us know. We'd be happy to sort of explore perhaps another session or some follow-up if that would be of interest. But thank you again to all of our panelists and to our participants. Wishing you an enjoyable rest of your day. Thank you, everyone.